So you specialize in stroke, and stroke is very common in Asian population these days. So let's talk about the basics of stroke first. What is stroke actually?
Sure. So, a stroke, broadly speaking, is any sort of damage that happens to the brain as a result of a problem with the blood supply to that part of the brain. And there's essentially two big kinds of stroke. There's ischemic stroke, which is a stroke that happens when a blood clot blocks off the blood flow to a part of the brain, and then that causes that part of the brain to get damaged and essentially to die off. And that's the most common type of stroke. And then the other type of stroke is called hemorrhagic stroke, and that is when there is a tear or other sort of damage to the blood vessel, and essentially there's bleeding out of that vessel into the brain. And so that's so broadly speaking, we can think of those as clot-related stroke and bleeding-related stroke.
Okay. So when I was reading for this episode, I read that when the blood supply stops to the brain because of blockages in the arteries.
Yeah.
So the blockage is due to the blood clot.
That's right, exactly, and that's what happens in ischemic stroke, the most common type of stroke.
Okay.
And in hemorrhagic stroke, the brain dies because, again, there's a loss of blood supply, but that's because there's actual bleeding that's happening out of an injured blood vessel, and the blood that bleed itself, related to the accumulation of blood in the brain, that itself causes damage as well. Yeah.
So are there any early signs of stroke that you could look out for?
Right. So one of the most common ones that we teach patients about, it can be remembered using a mnemonic called FAST. So that stands for face. F is for face, and that means some droopiness of the face or a facial droop. So one side of the face looks like it's sort of hanging down and not moving quite right. It's a very common sign of stroke. The A in FAST stands for arm. So, you ask the person to put their arms up, and then one arm is weak and cannot move. That's an important sign. And S is for speech. So stroke can very commonly affect our ability to talk, but also our ability to understand what others are saying. So language consists of talking and also ability to understand and communicate. And so stroke can affect that quite commonly. And then the T there is to remind us that time is brain, because when a stroke happens and either there's bleeding or the blood supply is lost, but particularly in situations where the blood supply is lost, the around 2 million brain cells die every minute that that blood clot lasts in the brain without being treated. Right. It's a very, very time-sensitive condition. And so the T is there to remind people that you see these signs of stroke, then act quickly, call for help. So FAST is the most common sort of tool that we use to teach people and educate the public about stroke. These days, people also use an expanded version of it called BFAST. So they add a B and an E before it, and that stands for B is for balance and E is for eyes. Because if somebody is suddenly unable to walk and suddenly unable to see, they're losing their vision, seeing double, those kinds of things, that can also be an important sign of stroke.
Okay. When these signs, one person sees these signs, is it still too late?
No, so that is why the T is there, because the T for time, right? So the moment you see those signs, you need to call for help right away. And the most critical thing is, if you're with somebody, don't try to drive them to the hospital. Call 911, because things might escalate very quickly. So what starts out looking like somebody that you might be able to take in a car can quickly become someone that needs some sort of support for their airway to keep it open, or needs other sorts of advanced medical care that can only be provided in an ambulance. Right. So it's very, very important when signs of stroke are happening to call 911 and get help that way.